What drew you to a career in learning disability nursing?
I have always been passionate about helping people live fulfilling lives, and learning disability nursing felt like a natural fit for me. My interest in this field was sparked during my volunteer work with individuals who had learning disabilities. I was inspired by their resilience and the unique challenges they faced in achieving independence and inclusion in society. Witnessing their progress, no matter how small, gave me a deep sense of purpose and satisfaction. What truly drew me to learning disability nursing is the opportunity to advocate for individuals who may not always have a voice, ensuring they receive the care, support, and opportunities they deserve. I was particularly motivated by the chance to build long-term relationships with patients and their families, helping to create tailored plans that promote physical, emotional, and social well-being. Additionally, I was intrigued by the multidisciplinary aspect of the role, working closely with other healthcare professionals, educators, and social workers to make a meaningful difference in people's lives. The combination of empathy, advocacy, and collaboration required in this field aligns perfectly with my values and strengths. For me, learning disability nursing is not just a career, but a commitment to helping individuals overcome barriers and thrive in their own unique way.
How do you approach building rapport and trust with individuals with learning disabilities?
Building rapport and trust with individuals with learning disabilities requires patience, empathy, and a person-centered approach. I always begin by taking the time to understand the individual as a person, learning about their preferences, communication style, and what makes them feel comfortable. Establishing a calm and welcoming environment is essential, as it helps create a sense of safety and reduces anxiety. Active listening plays a significant role in my approach. I ensure that I am fully present, giving them my undivided attention and validating their feelings and concerns. I use clear, straightforward language and adapt my communication style based on their needs, incorporating visual aids, gestures, or assistive technologies when appropriate. By showing respect for their unique way of expressing themselves, I demonstrate that I value their input. Consistency is another key element in building trust. I make an effort to be reliable and predictable in my actions, which helps individuals feel secure. Over time, I use shared activities or interests to build a genuine connection, showing that I am invested in their well-being beyond just clinical interactions. By involving them in decisions about their care and respecting their choices, I empower them and reinforce a sense of autonomy. Most importantly, I approach each interaction with authenticity and warmth. Trust is built through meaningful, positive experiences, and I am committed to fostering an environment where individuals feel understood, respected, and supported.
Can you describe a challenging situation you faced in a learning disability setting and how you handled it?
One challenging situation I encountered involved supporting a young adult with a learning disability who exhibited significant anxiety and behavioral challenges during transitions, such as moving from one activity to another. This often led to distress for the individual and disruptions for others in the setting. To address the situation, I first sought to understand the underlying triggers. I collaborated with the individual, their family, and colleagues to gather insights into their preferences, routines, and sources of anxiety. Through these conversations, I learned that abrupt changes to their schedule were particularly unsettling for them. Based on this, I developed a structured plan to support smoother transitions. I introduced visual schedules and social stories to help the individual anticipate what to expect throughout the day. Before any transitions, I provided clear step-by-step explanations using simple language and visual cues, ensuring they had ample time to process the change. I also integrated calming techniques, such as deep breathing exercises and access to a quiet space, to help them manage feelings of anxiety. When a transition did lead to heightened distress, I maintained a calm and reassuring demeanor, using distraction techniques or redirecting their focus to something they found comforting. Over time, with consistent support and positive reinforcement, the individual began to feel more secure during transitions, and their anxiety significantly reduced. This experience reinforced the importance of patience, adaptability, and collaboration in overcoming challenges in a learning disability setting. It was incredibly rewarding to see the individual gain confidence and engage more fully in their activities as a result of these interventions.
How do you ensure the safety and well-being of individuals with learning disabilities?
Ensuring the safety and well-being of individuals with learning disabilities requires a proactive, holistic, and individualized approach. First and foremost, I focus on understanding each person's specific needs, vulnerabilities, and strengths. This allows me to tailor my care and create an environment where they feel secure and supported. I prioritize clear and open communication, involving individuals in decisions about their care to the greatest extent possible, respecting their autonomy, and ensuring they understand the choices available to them. Building trust and rapport is essential, as it enables me to identify any concerns or potential risks more effectively. Risk assessment and management are central to maintaining safety. I regularly conduct thorough risk assessments to identify potential hazards in the physical environment, during activities, or in social interactions. I implement appropriate safeguards, such as adjusting the environment, using assistive devices, or providing close supervision where necessary, while ensuring the measures do not restrict the individual's freedom or dignity. To promote well-being, I emphasize a person-centered approach that supports physical, emotional, and social health. This includes encouraging healthy lifestyles, facilitating access to healthcare, and advocating for inclusion in social and community activities. I also pay attention to mental health, watching for signs of distress, anxiety, or behavioral changes, and responding promptly with appropriate interventions or referrals. Collaboration is key to comprehensive care. I work closely with families, caregivers, and multidisciplinary teams to develop and implement individualized care plans. By fostering open communication among all parties, I ensure that care is coordinated, consistent, and aligned with the individual's best interests. Finally, I stay up to date with policies, guidelines, and training related to safeguarding and learning disabilities, ensuring I am well equipped to recognize and respond to potential signs of abuse, neglect, or harm. By combining vigilance, empathy, and a commitment to empowerment, I create a supportive environment where individuals can thrive safely.
What is your experience with promoting independence and self-care skills in individuals with learning disabilities?
Promoting independence and self-care skills in individuals with learning disabilities has been one of the most rewarding aspects of my experience. I believe in fostering a sense of autonomy and confidence, tailored to each person's unique abilities and goals. My approach is rooted in patience, encouragement, and a person-centered perspective. In one of my previous roles, I worked with an individual who wanted to improve their daily living skills, such as preparing meals and managing personal hygiene. I began by conducting an assessment to understand their current abilities, preferences, and any barriers they faced. Together, we set achievable goals and broke them into manageable steps to build confidence progressively. For example, in teaching meal preparation, I started with simple tasks like washing vegetables or using a toaster, providing clear demonstrations and positive reinforcement. As they became more comfortable, I gradually introduced more complex steps, always ensuring the pace aligned with their comfort level. To reinforce these skills, I use visual aids, written instructions, and hands-on practice. Encouraging self-care skills involve creating a consistent routine and using reminders, such as visual schedules or timers, to support memory and organization. I also made sure to celebrate milestones, no matter how small, to boost their motivation and self-esteem. Collaboration with families and other caregivers was crucial to creating a supportive environment where the individual felt empowered to practice these skills consistently. I provided training and shared strategies to ensure that support extended beyond our sessions. Through this approach, I have seen individuals gain confidence, develop greater independence, and experience an enhanced quality of life. These moments underscore the importance of treating each individual with respect, patience, and an unwavering belief in their potential to achieve meaningful progress.
How do you adapt communication strategies to effectively interact with individuals with different levels of communication skills?
Adapting communication strategies to interact effectively with individuals who have varying communication skills is essential in learning disability nursing. My approach is rooted in understanding each person's unique needs and using flexible, person-centered techniques to ensure they feel heard and understood. I begin by observing and assessing the individual's preferred method of communication, whether verbal, nonverbal, or through alternative means such as gestures, facial expressions, or assistive technologies. For individuals who use limited verbal communication, I incorporate visual aids like pictures, symbols, or communication boards to enhance understanding. For instance, using a choice board allows individuals to point to their preferences, empowering them to express their needs. When interacting with someone who primarily relies on nonverbal cues, I pay close attention to their body language, tone of voice, and facial expressions to interpret their feelings or concerns. I also use my own body language deliberately, maintaining a calm and open demeanor to create a reassuring environment. For individuals with more advanced verbal skills but who might process information more slowly, I ensure my communication is clear and concise, avoiding jargon or complex sentences. I also provide ample time for them to process the information and respond, showing patience and avoiding interruptions. Checking for understanding is vital, so I may ask them to repeat back instructions or summarize their thoughts in their own words. In cases where assistive devices like speech-generating devices or apps are used, I familiarize myself with the technology and encourage its use to support their autonomy. Collaborating with speech and language therapists, families, and caregivers also helps me refine strategies and tailor communication methods to the individual. Above all, I approach every interaction with empathy, respect, and adaptability. Building trust through consistent and personalized communication ensures that individuals feel valued and confident in expressing themselves, regardless of their level of communication skills.
What is your experience with supporting individuals with learning disabilities to manage their health conditions, such as medication administration and dietary needs?
Supporting individuals with learning disabilities in managing their health conditions, including medication administration and dietary needs, has been a key aspect of my nursing experience. My approach focuses on education, empowerment, and collaboration to ensure that individuals can engage with their care to the fullest extent possible. In medication administration, I prioritize safety, understanding, and compliance. I take the time to explain the purpose of each medication, its benefits, and any potential side effects in a way that is accessible to the individual, often using visual aids or simple analogies. Where appropriate, I involve them in a process, such as helping to organize their medication in a pill organizer or setting reminders for the correct times to take it. This not only promotes independence, but also fosters a sense of ownership over their health. I also work closely with families and caregivers to ensure consistency and adherence to prescribed regimens, and I am vigilant about monitoring for any signs of adverse reactions or challenges in taking medications. When supporting dietary needs, I emphasize the importance of creating a balanced approach that aligns with the individual's health requirements while respecting their preferences. For example, I have worked with individuals who needed to manage conditions like diabetes or obesity, which required tailored meal plans. I collaborated with dietitians to develop practical and enjoyable food options, ensuring the individual understood why certain choices were healthier and how they contributed to their overall well-being. Using tools like visual meal planners or cooking demonstrations, I help make the concept of healthy eating tangible and achievable. For individuals with swallowing difficulties or sensory sensitivities, I adapted recommendations by consulting with speech and language therapists or occupational therapists to ensure that dietary modifications met both their medical needs and personal comfort levels. Throughout, I encouraged open communication so individuals felt comfortable voicing their likes, dislikes, or concerns about their care plan. Ultimately, I approach health management with a focus on empowerment, ensuring that individuals are as actively involved as possible in decisions about their care. By building trust, using tailored strategies, and fostering collaboration with multidisciplinary teams, I help individuals with learning disabilities lead healthier and more independent lives.
How do you promote social inclusion and community participation for individuals with learning disabilities?
Promoting social inclusion and community participation for individuals with learning disabilities is central to helping them lead fulfilling and empowered lives. My approach is grounded in fostering confidence, breaking down barriers, and creating opportunities for meaningful engagement in the community. I start by understanding each individual's interests, strengths, and goals, ensuring that activities are aligned with their preferences and abilities. For example, if someone enjoys arts and crafts, I might help them join a local art class or participate in community workshops. For those who prefer outdoor activities, I support their involvement in gardening groups, sports, or walking clubs. Tailoring activities ensures that they feel motivated and comfortable, which is key to building confidence. To overcome barriers, I work closely with individuals, families, and community organizations to address accessibility needs. This includes advocating for accommodations such as wheelchair access, sensory-friendly environments, or visual aids, ensuring that participation is as seamless as possible. I also educate community members and staff about learning disabilities to foster a more inclusive environment and reduce stigma. Building social skills is another essential part of my work. I use role-playing and structured opportunities to help individuals develop confidence in interacting with others. For example, I might practice conversational skills with someone before they attend a social event, helping them feel more prepared. I also encourage peer-to-peer connections by introducing individuals to group activities where they can build relationships with others who share their interests. Collaboration with support networks is crucial. I work with families, caregivers, and multidisciplinary teams to identify opportunities and provide consistent encouragement. Additionally, I advocate for volunteering opportunities or supported employment when appropriate, helping individuals contribute to their communities in meaningful ways. Through these efforts, I aim to create a supportive environment where individuals with learning disabilities are empowered to connect with others, develop a sense of belonging, and actively participate in their communities. Witnessing their growth in confidence and joy from being included is one of the most rewarding aspects of my work.
What is your understanding of person-centered care, and how do you apply it in your practice?
Person-centered care is a fundamental approach in nursing that emphasizes treating individuals with dignity, respect, and compassion while tailoring care to their unique needs, preferences, and aspirations. It focuses on empowering individuals by involving them actively in decisions about their care, ensuring their voices are heard and valued. In my practice, I apply person-centered care by first building a comprehensive understanding of each individual. This involves taking the time to learn about their background, strengths, challenges, and personal goals. For individuals with learning disabilities, I ensure that communication is adapted to their level of understanding, using tools such as visual aids, simplified language, or assistive technologies to make discussions accessible and inclusive. Collaboration is at the heart of this approach. I work closely with the individual, their families, caregivers, and multidisciplinary teams to create care plans that align with their preferences and priorities. For example, if an individual expresses a desire to gain more independence, I focus on strategies that promote self-care skills, social inclusion, and decision-making. Flexibility is another key component of person-centered care. I recognize that needs and preferences can change over time, so I continually assess and adjust care plans to ensure they remain relevant and effective. For instance, if someone is feeling overwhelmed by a particular goal, I break it down into smaller, more manageable steps and celebrate each achievement along the way. Respecting autonomy is critical, even when safety concerns arise. I engage in open, non-judgmental discussions to explore options and provide the information needed to make informed choices. By balancing empowerment with safeguarding, I ensure that care promotes independence while mitigating risks. Ultimately, person-centered care is about seeing the individual beyond their diagnosis or disability. It's about honoring their humanity, fostering their strengths, and creating a supportive environment where they can thrive on their terms. This approach not only improves outcomes but also builds trust and strengthens relationships, making it an integral part of my practice.
How do you stay updated on the latest evidence-based practices in learning disability nursing?
Staying updated on the latest evidence-based practices in learning disability nursing is essential for providing high-quality care. I adopt a proactive and multifaceted approach to ensure my knowledge and skills remain current and aligned with best practices. I regularly engage with professional development opportunities, such as attending workshops, conferences, and seminars focused on learning disability nursing. These events allow me to gain insights into emerging research, innovative care techniques, and policy updates while networking with other professionals in the field. I also subscribe to reputable nursing journals and publications, such as the Journal of Learning Disabilities or similar resources, to stay informed about new studies and evidence-based interventions. Reading peer-reviewed articles helps me critically evaluate new approaches and consider how they can be applied in my practice. Participating in online forums, webinars, and communities of practice is another way I stay connected with advancements in the field. Platforms hosted by professional organizations like the Royal College of Nursing, RCN, or equivalent bodies provide valuable opportunities for knowledge sharing and discussion. I prioritize continuing education, enrolling in relevant courses or certifications that deepen my expertise in specific areas, such as positive behavior support, PBS, safeguarding, or assistive technologies. These learning experiences equip me with the tools to address complex challenges more effectively. Collaboration with colleagues and multidisciplinary teams also plays a vital role. Regular team meetings and case discussions often highlight new strategies or evidence-based practices being implemented across disciplines. I actively seek feedback and share insights to foster a culture of continuous learning. Finally, I ensure that my practice adheres to national guidelines and frameworks, such as those set by the National Institute for Health and Care Excellence, NICE, or similar organizations. By routinely reviewing these standards, I align my care with established benchmarks and recommendations. Through this combination of continuous education, professional engagement, and practical application, I maintain a high standard of care and remain well prepared to meet the evolving needs of individuals with learning disabilities.